Paromita Sen. I started at SEWA Bharat a year and a half ago I started the Learning Hub, which is our internal research and data team. The way our research works is at SEWA Bharat and at SEWA is that the research questions, the needs, they all come from the community. I'm not usually sitting around here being like, "Ooh, what is this research question that I want to tackle here?" It comes from what the community has identified as their needs and as their concerns, and then I put it together. I give it the framework, I give it the structure, I bring in the research training over there. But the actual content, the meat of the work that we're doing comes entirely from the community. We're also doing a lot of work in the policy space, like taking the concerns off our members and then trying to channel it towards policy. A lot of our work is right now going into little policy notes that go to different ministries or to different private sector actors. We're doing a lot of work with private sector actors because so much of our work is around production. They're informal economy workers, so they have their own. We have our own collective enterprises, producer companies, and they're making things, right? So connecting them to say a Kinara Capital really helps them push for a private-public partnership and start getting some the economy is slowly moving again a little bit in these spaces. So that's a lot of where our research has been.
With this kind of transition from more internally facing research to externally facing, can you talk about, so was the motivation to work on researching COVID's impact in India driven by your union members, or is it something that you as an organization, or a little bit of both?
It was entirely driven by our members. I would have probably come to it about 10 days after they thought of it, but they thought of it first. I'm the first person. I was the first person to admit that. So the primary focus of the research team has been on collective enterprises. We've come on part of a BMGF project called MOVE, BMGF funded initiative called MOVE, Mahila Owned Viable Enterprises, and we've been working on this for a year. A lot of great work around this, and that's led to a certain level of tunnel vision. That's what we were focusing on. We were trying to get that. And when you're looking at a collective enterprises, the impact of COVID and the lockdown hits them a little bit later than it came to just self-employed informal economy worker. The impact was a little later when it came to collective enterprises because the enterprise is a business in itself, right? It's a legal entity in itself that bolstered it a little bit longer. So it was through other union work that we figured out that the impact of the lockdown, and it wasn't just the impact of the lockdown for us, because CA NRC started in December, leading into January, and then Delhi in February, which is where our team is based out of. We saw the Delhi riots. And then we had the lockdown, right? So these three together. So by the time the lockdown came, we were already very worried about livelihoods generally in the informal economy because of the previous two. And then in some ways, for instance, the global supply chain, because China went into lockdown in January, we started feeling those impacts in January itself because our home-based workers, our weavers stopped getting raw material from China. So they weren't able to finish their products and get it out. These were concerns that got raised back in January for us. So by the time, and then February happened, and then home-based work completely came to a standstill in Delhi because of the riots. So by the time March came, our workers were very concerned already.
Could you talk about both the intent for the research outputs in terms of how it's going to be internally used and beneficial to your members, as well as what you were envisioning doing with that information and an external focus?
Yeah, so internally, I start with the internal because that's where a lot of the focus has been so far. Internally, for instance, we do a lot of, we send the support back to the union. A lot of our work has actually just been supporting our teams with data collection. And what are the kinds of data you want to be collecting at this level? Data collection and something like this, one of the major challenges, of course, is that our data collection used to happen door by door. Our union members, like the workers in the union, are in the community, so they would just go door by door and get whatever information is needed. That's not possible anymore, right? I mean, we were actively discouraging that for the longest time because we didn't want our communities are vulnerable enough with weak health infrastructure. So we took on a lot of that, like helping them design questionnaires, helping them figure out how to do it on their phones, using whatever basic technology we had to try and help them get data. what kind of data they would need, right? And that was where a lot of these like external conversations we've been having have helped, right? Watching other people being like, these are the kind of criteria you need to collect data on to get this finding is something that we found very useful, because it allows us to like help give that back to the union, saying if these are your end outcomes, this is the kind of data you want to collect now, so that in a month we can get this done. Because there's also the lag, right, between like data collection and then actually getting to do anything with the data. So right at the basic level, just helping the union teams with data collection. Then we've been collecting a lot of this thing. We aggregate our member data up to like at the national level across various states, and we come up with recommendations by trade. That's one of the things we've really worked with. Is the trade level, right? Because there's a very differential impact between what a domestic worker is able to do through this lockdown, what a street vendor is able to do.
Could you touch upon some of the, I guess, similarities and differences that you're seeing in terms of COVID response, the understanding of the pandemic, from all these disparate contexts that you're working
Yeah. Yeah, so some of the things that we're seeing is, I mean, as I mentioned, trade specific barriers, right? It's a trade specific thing, but those kind of hold across the country, right? So domestic workers' experience out in West Bengal is very similar to domestic workers' experience out in Jharkhand, right? It's different from a trade street vendors, but as a domestic worker, the stigma associated with having to go into work, the additional stigma now associated with being, like potentially a COVID carrier, um, access to sanitation, access to water in your settlements. Informal settlements kind of look similar across the country, right? So how your housing is related to your livelihood. Housing is relating to your livelihood is such a key thing, right? And that's such an important finding that we've discovered through this, right? From before the lockdown, even one of the things we were noticing is when we were asking people how to prepare for the lockdown, right? Access to water, access to drainage, sanitation, sewer systems. These were such key elements, right? Like the amount of impact that we like for us as an organization, we're really trying to figure out how to draw attention to this, because we've always known housing is related to livelihoods, right? But this has really shown us how housing is related to your ability to survive, right? And with migrants becoming homeless, and like that relationship, what it means for them to have to come back and maybe resume their livelihood. So housing across the country has been a very critical thing, like the role of an informal settlement. And that's, of course, now taken to a national level, because in Delhi, the railways, they've decided to evict 48,000 homes along the Delhi railway. It's now been paused for 4 weeks, right? But like in the middle of a pandemic, to make an additional 2.5 lakh citizens homeless at a time when anywhere we're dealing with a crisis of home of the unhoused in this country, how to balance that, right? Yeah.
Gotcha. Yeah, it's great to hear you touch upon that. And others have, in terms of the kind of systemic inequities that COVID has really laid bare, and the need for kind of a holistic response to this, because in many ways the pandemic is just a symptom of a larger disease. And
Yeah.
so with all of these learnings that are emerging, like I guess, could you just talk to the aspirations for the impact that you hope your work will have for your members, as well as just in shedding light into pandemic response?
Yeah, so we're doing a couple of things, but basically we're pushing for a lot of it at the policy change level, right? I mean, that's our strongest thing. We are a central trade union, so that's where one of our largest thrusts is. So, for instance, we are working on a task force for the future of work in the urban informal economy. And when designing a survey, right, as a researcher, when I'm designing a survey to ask people, I ask demographic details, like marital age, income, blah, blah. However, we've now realized that let's not do that. Let's just go directly to the questions that will help us make a policy recommendation.